So, welcome to my weekly live in the Facebook group Wild Wisdom for Women with Dr. Patricia Mills. I'm Dr. Patricia. Very excited to be here with you today. And if you're joining me live, put in your name and where you're joining in from in the comments. And if you're joining me on replay, if you're watching this as a replay, put in your comments as well. I love to see what you have to say, and it guides me in terms of what information you want me to talk about. Is this the kind of information that you want? So please do so. I would love to hear from you. So I wanted to talk today about hormones and hormone testing, okay? Because this has been coming up a lot. And now, just so you understand, like I'm a medical doctor who trained and I specialized in physical medicine and rehabilitation. So in my training, I did like obstetrics as part of my rotations and that kind of stuff. And because I worked with people with traumatic brain injury, we had, and individuals who had everything from concussion to more severe traumatic brain injury get hormonal imbalances. They have to be tested. Now, so that's like where I was coming from, was looking at a little bit of the dysfunction of doing, of like what happened as a result of the brain injury and the brain not communicating with the organs of hormone production. And additionally, when I was trying to get pregnant with my first son, which took a couple years, I had issues with fertility. I went through a lot of hormone testing. So I experienced the hormone testing that happens like through your medical doctor, through your family doctor. And then I experienced the hormone testing through a fertility doctor. And then and now I'm doing my functional medicine certification. And so I did like 3 intensive days, like plus pre-materials, post-materials, lots of reading, all that kind of stuff on hormones, like just hormones. And it was really fascinating to me because there was like 3 hours or so just on hormone tests, like available hormone tests. How can you test your hormones now with the tests that are currently available, right? So there's all these different ways. You can test it with your blood, you can test it with your saliva, you can test it with your urine. And every test will be like, we're the best test. This is the best test. Fortunately, the functional medicine team did a really good job of being like, these are the pros and cons of all of these different tests. Now, what I'm not going to do is go into each test. What I am going to do is give you an overview of like, what are these tests doing and what are the limitations of these tests, okay? Right up the front, one really big limitation is that it's like a one-time snapshot of your body. So like you take your saliva, you take your urine, you take your blood, right? And let's say, as an example, let's say there's like a car accident is happening and there's like a camera that's looking at the street and happens to be capturing like wide scope, the full car accident. So it's a video camera, right? Now, in order to fully understand the whole car accident, you need to see all of the shots, right? Like how it started to how it ended. A hormone test is like a single picture of the scene. So like the 2 cars are now like starting to touch each other, and that's the picture that you get. Well, you don't know, are they touching each other because car A was driving erratically, or was car B driving too fast, or did car B slam on the brakes? Like, you just don't know, right? You don't have the full picture, the full video, so to speak. And so right off the bat, that is a massive limitation with all blood work, where you go in for your blood work and you get it done once, which is typically what your medical doctor, your family doctor does. If you start working with like a fertility doctor, they might get you to do like different times of the month. Like, okay, let's say your goal is to get pregnant. And you're like, why am I not getting pregnant? Because you usually don't get hormone testing unless you're not getting pregnant, right? Like if you want to get pregnant and you get pregnant, like you're never going to get hormone testing. So usually when you're doing hormone testing, it's usually through like the medical system, it's usually prompted by a problem, right? Like if you, like, tell me if this makes sense to you, right? So it's like, and that makes sense from like a money perspective, because the governments only have so much money. And if they were to do hormone testing on everyone, it's kind of useless information because, again, it's like that snapshot of like the traffic, right? And you're just getting snapshots of how people's hormones are, but you're not getting the full story of like what's going on. Did an accident even actually happen, right? Can you tell from that picture that it turns into an accident, right? Maybe they touch and they go off. So a one-time snapshot of people's hormones will not tell you where they are with their health, what's going to happen with their health, okay? Unless it's like extremely off the charts, like unexpected results, like really, really, really unusual, and that's not common to have. So it's not worth it for the government to pay all this money for everyone to get tested. So the government will pay when there's something that triggers the concern. And even with fertility tests, oftentimes you have to pay more money to do the more in-depth testing. And even with those tests, it's like, they'll test you, for example, for your progesterone level, because progesterone is a very strong hormone for pregnancy. However, progesterone is also important for breastfeeding. So if you're having problems with breastfeeding, your progesterone is probably not good enough. If you're in menopause and you're feeling irritable and you're feeling like short-tempered and like angry and it's hard to chill out, that's a sign that your progesterone is low. And if you're premenopause, you don't even care about getting pregnant, but you're in your fertile years and you also feel that way, that's a pretty good sign that your progesterone is low relative to your other hormones. So again, that's the other thing. It's not so much what is the absolute level of progesterone, but what is your progesterone in relation to the levels of estrogen and testosterone and cortisol, which is your stress hormone, okay? So, but let's say you're getting your test for fertility and they'll say, okay, well, let's test then 18 to 24 days after your period, right? Your first bleeding day, 18 to 24 days. If you have good progesterone levels, it should be high enough, like it should be within a range. Okay, so you get that one test, that one day that you happen to go into the doctor's office, okay? And here's the thing about progesterone, for example, okay? Progesterone is made from the hormone, progesterone is made from the mother hormone pregnenolone. Pregnenolone can have two children, progesterone and estrogen, and DHEA and progesterone. And then progesterone is needed to make cortisol, which is your stress hormone. So let's say you go into the doctor that day and you're like running late, you're super stressed out because you hate needles. You're really upset and annoyed by like something that happened at work, and your body, and this has been going on for a few days, and your body has been pumping out cortisol. Well, it's probably been depleting your progesterone because it's using the progesterone to make cortisol, right? Progesterone. So you may get like a low progesterone. Now, if your life is consistently stressed out like that, then that's a pretty accurate picture of the fact that you have low progesterone because you are stressed out all the time and your cortisol levels are going up and your progesterone levels are going down as a result, right? So progesterone is like your chill hormone. It's your feel-good hormone. It's the hormone that makes you feel relaxed. And so if you're someone who has, for example, premenstrual syndrome or irritability that fluctuates during the month or short-temperedness that you seem to like just, it just comes upon you, that kind of thing, that can be your progesterone levels being too low. And there's many different reasons for that. But I would say in today's society, the number one cause of that is the cortisol level being too high. And cortisol level can be too high from physical stress, like overworking out, okay, not respecting the body's energetic fluctuations and the need for recovery, rest and recovery. It can be from having coffee, too much coffee. Coffee spikes cortisol. It can be from having foods that don't agree with your body, which causes inflammation, which rises cortisol. That is a fact. That's been proven in science. It can be from too much sugar in your diet, like flour products, refined sugar, and from mental and emotional stress, right? Like having life throw at you life things and you don't have the tools with which to cope with those things, okay? So here you have cortisol's going up, progesterone's going down, and boom, you have a hard time with your pregnancy, you have a hard time with your fertility, you have a hard time feeling chill, you have a hard time feeling good before your period or during your period, you have a hard time having a perimenopausal experience that is smooth, and you're kind of suffering through your menopause, menstrual mayhem. All of those things can happen from low progesterone, or if you're breastfeeding and you can't produce milk, that can happen from low progesterone, right? Okay, so here's the argument that I want to make, all right? Let's say you go in and you get the test, and your progesterone is low, right? Because you're having problems with fertility, or your postmenopause, premenopause, whatever it is that you have. You're going to be having to do all the things to bring progesterone up to make you feel better. Okay. Now let's say that you go into the test and you go in and so first of all, just as a caveat, I have not heard, and this is like, correct me if I'm wrong, so put it in the chat if this has happened to you, but I have never heard of a woman who has a hard time conceiving and getting fertile, or who is having difficulties in menopause, having completely normal progesterone levels at every point in time they get tested. Okay. And so here's an example for me. So I went in and I got tested, and the first test, my progesterone levels were like within normal range. Here's a problem about within normal range. Within normal range gets pulled from all of the women who get tested. And what did I say about people who are getting tested? Those are people who are having problems. Those are not people who are like in their thriving health, right? Like getting pregnant, not getting the tests. Okay. So here you have, like, I was within normal for women who were getting tested for progesterone. So, that doesn't really tell you much. All it tells you is that you're not like way, 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 way down in your boots to low progesterone compared to everyone else who has low progesterone, right? And then when I got tested again, then my progesterone was low, which really was a signal like, oh my gosh, like my progesterone was really, really, really low. So, that's the thing, like blood testing can be like a wake-up call to people. So it's like, okay, oh geez, like, I don't know, I'm having a hard time getting pregnant. I wonder why. And they're not aware of what I just told you about how progesterone needs to be like really nurtured through decreasing physical and emotional mental stress. So they go and they get the test, and two things is going to happen. They're either like, in my opinion, low enough that they can't get pregnant, so low enough for their body, but pretty much the same as other women who can get pregnant, in which case the reading will come back normal, or really low, and even compared to other women who can't get pregnant, and so now their test is like low. So what do fertility doctors typically do? They typically, for women who are having a really hard time getting pregnant, even if the progesterone levels comes back like within normal range, they will still prescribe the woman a progesterone, medication. Why? Because they know that progesterone is necessary for maintaining a pregnancy. And if the person is not maintaining a pregnancy, they probably have low progesterone. Like, that is a pretty clear indication they have low progesterone. So they will give the woman progesterone therapy, even if their blood work comes back as within like the normal range or the low to normal range. And they'll do it what they call a trial. Like, we're going to try this out because maybe this will be what you need to get pregnant, right? So pretty much almost every single woman who is going to a fertility clinic at some point in time, like if they don't get pregnant, they're going to go on a trial of a progesterone therapy, regardless of what the blood work is showing. At some point, like at first the doctor might say, well, oh, your progesterone is okay, so why are we going to top it up? And then after a while, they're going to be like, well, you're still not getting pregnant, so let's do a trial of progesterone, okay? And then what was interesting was when I was doing my functional medicine training, even those tests, like, they're not perfect. Like, no test is 100% perfect. They even show that where the laboratory that it's drawn affects the readings, right? Which is why each laboratory takes their own data to give a range of normal. Remember, just because it's common doesn't mean it's normal. So that's what they're doing. They're giving you a common range, but they're not giving you like an optimal health range. That's for every test, by the way, with a few exceptions like cutoffs for anemia and that kind of stuff. Okay, but like thyroid testing, also this happens in thyroid testing, okay, because it does change from laboratory to laboratory, so they have to create their own value ranges. Okay, the other thing is that, so you have your, and then there's all of this debate, like, is it better to do it through the saliva? Is it better to do it through the urine? Is it better to do it through the blood? And for each hormone, they have like, this hormone is best for this hormone is best for that. And then there's like the time of the day. So like some hormones, you get a clearer picture if you do it first thing in the morning when you wake up without having eaten or drinking anything, like cortisol, for example. And then some of them, it's like you need to see the pattern. So with cortisol hormone testing, for example, it's useless to do like a 1-point test. You want to do like first thing in the morning, and then later in the morning, then the noon, then the afternoon, the nighttime. Like you want to do 4 to 5 point tests because you're looking for the trend. Because with cortisol, you want the trend to be like up in the morning, down in the rest of the day. So if you see something like flat through the day or up, never comes down, right? Like then you start to be like, well, that's not good. Like you're very stressed out. My take on this, after having seen and done myself quite a bit of blood work and seen quite a bit of like tests from other people, is that I can pretty much predict what a person's going to have on their hormone test just by them filling out like these very hormone specific questionnaires and doing a very detailed history. Okay, because if you have low progesterone, and the like, you know, and so again, I mentioned some indicators of that are like you're angry, you're irritable, you're short-tempered, you're having problems with premenstrual syndrome, you're having short menstrual periods, like especially it's called the decreased luteal phase, because you need to have enough progesterone to maintain the lining of the uterus for like a long enough period of time to get pregnant. And then you don't get pregnant, the progesterone naturally comes down and you shed. Well, if you don't have enough progesterone, that phase gets shorter. So you have shorter kind of cycle lengths, or maybe you get like really heavy hemorrhagic periods. That can be another thing, really painful cramping periods. And then all the way through to like not being able to get pregnant, getting pregnant and not maintaining a pregnancy past first trimester, not being able to breastfeed because the progesterone is so low. Again, that could be cortisol, like the stress of a motherhood and not feeling supported in motherhood, which I certainly went through that myself too. Had a lot of issues with breastfeeding, and then going through a terrible perimenopause and menopause, right? So for example, like because I've noticed that blood work was like very expensive sometimes, right? And I was pretty much able to predict what people had just based on what they were experiencing. I researched a lot of like hormone questionnaires, and what I like about them is that they ask a bunch of like questions about about how you're feeling, how you're thinking, how your body is doing, what's showing up in your body. And you reflect on how it's been for like the last month or the last year. So you get a sense of like, not the last second, which is what the blood work will show you. Like, how is your hormones in the last second, right? So you reflect how you've been doing, and these trends start to pop up. Like there's very clear indications when you're having thyroid dysfunction. There's very clear indications when you're having estrogen and progesterone, testosterone imbalances. There's very clear indications when your testosterone is too low. There's very clear indications when your progesterone is too low. Okay. The one time that I think it's worth doing testing, there's two situations where I think it's worth doing testing. And even then it's like very interesting, right? So one situation is, like I mentioned, you have like a very obvious condition and your doctor wants to test you for that condition. So like, for example, it can be useful to test for things like ovarian cysts or ovarian cancer. If your progesterone levels are really off the charts, that would trigger your doctor to be like, whoa, like, okay, we got to go looking for something because your progesterone is too high. You can have like adrenal, because your progesterone, all of your hormones, by the way, are made in your ovaries and your adrenal glands, your sex hormones, okay, in certain amounts. So if you have like a dysfunction of the ovaries or dysfunction of the adrenal glands, like a tumor or a cyst or something like that, then your hormones level will go up. However, you probably are not feeling in vibrant health if that's happening, right? So that's not a test that you would do. Like you're feeling fantastic, everything is great, and then you do this test, and all of a sudden it's really high. No, like you would know, like you would feel very unwell with things being that high. So the conditions is like, if your doctor tells you you have to get the test, you get it. You don't say, I don't want the test because Dr. Patricia said that's not useful. No, like if under certain medical circumstances, it can be very useful if you're feeling really unwell. And I would say the other circumstances, like let's say you're someone who has like a strong history of breast cancer, or let's say you're someone who knows that you should be changing your lifestyle up, because why do we get the test? We get the test to know about how well is our lifestyle serving us, right? How well is our body working right now? How well is our body interacting with the way I'm thinking, what I'm putting on it, what I'm putting in it, how I'm moving it, right? The environment, like the toxic exposures, if any, how am I detoxifying? Ultimately, like we always were taught in medicine, like there has to be a reason as to why you get the test. Okay. And that reason deep, like if you really, really dig deep down into it, it's like it's to understand like, is my lifestyle working with me? What I would say is that your body language, which I pick up on these questionnaires, is telling you that, right? Like if you're listening to this and you're like, oh my goodness, like I am fine, like my body is perfect. It's like everything is great. I have wonderful relationships with my family and friends. I don't get stressed out by world events. They don't bother me, like they come and go, they don't worry me. My hair is great, my skin is great, my vision, my smell, my taste, my joints feel amazing. I'm strong, I'm flexible. I have wonderful cardio. My gut, like I'm pooping like clockwork every day. My belly is flat, it's not bloated. Like yeah, I think you can see where I'm going with that, right? Like, and as soon as you start to deviate from that, that's a sign that and I know we say a lot of things about aging, but one thing I've learned is as I've like really dug deep into my lifestyle and changed my lifestyle around, I've aged in reverse. Like I would say I'm in better health now than I was in my mid 20s, even early 20s, I would say. Maybe even before that. I don't know, like I feel like I'm in the best health of my life to a certain extent, actually. And research shows that you can age in reverse. So you can actually physically age in reverse, not chronologically, but biologically age in reverse. So I don't think aging should be an excuse for you to start feeling less energetic, for you to start feeling more irritable, for you to notice all of the changes in your skin, in your hair, in your around your belly, in your gut, in your like everything, your vision, all that stuff. That's a sign that there's something that could be improved upon in terms of the lifestyle that you're adopting. And what is showing up, the proof is in the population. The standard American way of living is not conducive to good health, period. Okay. If you're blessed with amazing genetics, like my husband, for example, has I don't know, he's got crazy genetics. Everyone in his family lived past 100 and he doesn't seem to be aging like a day, but he's like a very rare individual. Most of us do not have that, okay? And so most of us are experiencing, and it's kind of like the frog in the pot. I don't know if you ever heard the story where, if you put a frog in a boiling pot of water, it'll immediately jump out. But if you put the frog in a pot of like lukewarm water and you slowly heat it up, it'll start to become like, it'll adapt and it'll be like, this is normal, this is normal, this is normal. And then it'll die boiled to death in the pot because it was such tiny little changes over time. And a lot of us either experience like tiny little changes over time and then we find ourselves with the current state of health we are in, which is a result of a lifelong accumulation of habits that we were erroneously, not purposefully, no one's out to get anybody, but we just simply went down the wrong road when it came to health maintenance. Western medicine is not taught health maintenance. I know this as a medical doctor. We are taught how to diagnose disease and how to use medications to reverse disease. And we're taught a little bit as a physical medicine and rehab specialist. I was like, in my specialty, we were considered the ones that were like with sports medicine, for example, to be able to provide like an exercise prescription. But none of us actually were taught enough to be able to provide dietary recommendations. Full stop. Never. Okay. So we got a couple hours of training on nutrition and it was very basic, like proteins, fat, carbs, that's it. Like here, a few vitamins, not even, all right? Like that is the truth. So in order for me to be the nutrition expert that I am now, I have had to put in hundreds of hours of learning and training and reading and researching and everything to get to where I'm right now and applying it in my life, trying different things out, actually putting it into practice, like actually cooking the foods for my family as a busy mother, busy doctor, incorporate into lifestyle, all of those things. So basically what I'm saying to you is that why don't you just assume that you're like almost every single woman in the modern world, you know, living in this modern life, which is very stressful, and is inundated with processed foods, which are irritating and destroying the lining of your gut and making it very difficult for you to absorb your nutrients, and causing some low-grade inflammation that, when persistent, can really start to irritate your system and cause issues with your health. And start working on that. You know what I mean? So you start making the small changes every day, the things that I'm teaching you in Wild Wisdom for Women Facebook group, like, you know, just adopt one habit every day, one small change every day, one tiny shift, one tiny sustainable shift, right? Now, if you want to make massive changes in your health really quickly, then you need to hook up with someone like myself or another health expert to guide you along like the massive shifts. And then you need a lot of inner motivation. Like, I provide the education, you provide the motivation and the action, right? And then what I do is, if at the end of getting your lifestyle like really honed in, really nailed down, really, really, really good, everything, like there's literally like, you know, you're doing your best, like, you know, 80% good, 20%, like, you know, there's life, like going out for your pizzas with your family, your birthday cakes, that kind of stuff. And if you're still not feeling optimally well at that time, then I would say it's worth doing a blood test. Because, you know, at that point in time, like, you've got your stress managed. Like, you know, when I work with my clients, we do a lot of stress management stuff over time, right? Like, first we work on the diet, and then we work on the inflammation, and then we work on the stress, like detoxification, all that kind of stuff. So all those things need to be addressed. When would you do a blood test before that? Well, first of all, if you're someone who likes to sort of just test things, so which I, you know, some people do. Like, I know, for example, my mom really loves to see all the blood work, and that's great. You want to spend the money on that? That's great. It can get very expensive, and you spend the money. You have your baseline tests, okay? And then you do the lifestyle changes, and then you retest and you see the change, okay? That's definitely one way you can do it. The other reason you might want to do it is if you're someone who has a really hard time finding inner motivation and you need the proof in order to make the action in your life. Like your body language is not enough because you're like the frog in the pot. You're kind of used to it, and you're like, well, I know this is like feels normal to me. Like, it's kind of normal to wake up this way and feel this level of energy, and it's normal for me to have this digestion and whatever, right? And so then having the blood work might be like the motivation, right? Like, okay, oh my goodness, like my cortisol is like tanked because I've run it out. My progesterone is so low. My testosterone's in my boots. My estrogen's all over the place. I really got to work on myself. And so if you're someone who needs that motivation, by all means, just be aware that sometimes the test can be within normal range and it's not normal. It's not optimal health. It's a one-time picture. So again, it could be that that day it just so happened that the progesterone was high because you meditated that day, but you don't usually meditate, right? And you know, so that's the problem. They're called like false negatives and false positives. So it's like falsely within the normal range, falsely within an abnormal range, and then it can kind of scare you too. I mean, that does happen in blood tests where you get like the wrong like result, and then everybody gets really freaked out. And then they retest it, and it's like, oh, actually, sorry, that was an error, right? That was just like an error in the blood test or in the urine test or in the sweat test or whatever that is. Now, there is one test that I really, really love, and I'm even using it right now, which is the continuous glucose monitor or the blood glucose testing, and that is something that I absolutely love. And you can see here, I'm wearing my continuous glucose monitor for the first time. Before that, I was doing finger prick testing, which is wonderful as well, more economical for sure. This is because in my field, I want to test out all of the technology and I want to see how it works. I want to do all the blood work and all the tests so I can teach you about what my experiences are. And with the blood finger testing, it's not the one-time test that's going to tell you how you're doing with your diet, like how is your diet affecting your blood sugars. It's a testing over time. So for example, I'm working with some Body Wisdom clients right now in my Body Wisdom program. We're currently in the blood sugar testing phase, and we're noticing the patterns over time, right? And there's like an art to interpreting the patterns and problem solving, like why is that blood sugar high even though you had nothing to eat? You know, why are you waking up with blood sugars hours, even though last time you ate was 8 p.m. Like there's all of these things you have to know to understand, like, okay, now I have this result. What am I going to do with this result? So here's the other caveat. If you're going to do blood testing, make sure you have a person who can sit with you and interpret the results and give you like adequate, and sometimes the issue I have sometimes is when you do the blood testing with the person who's going to treat you, there's this inherent bias, and it's not purposeful, but it's like almost accidental, where like, if something could be interpreted like, oh, don't worry, this is like kind of okay, or versus like, oh no, we really got to work on this, they're going to do the we got to work on this interpretation, because there's sort of like motivation for them to continue working with you, right? So it is sometimes nice to have like an external bird's eye view to kind of like look at the tests that you have done, look at it with you, really sit down, work it out. But that person needs to still do questionnaires, take a history, right? And talk to you, because on its own, the blood test is useless. It has to be in combination with your body language. It has to be in combination with like, how are you sleeping? How are you feeling? How is your skin? Do you have fibroids? Do you have endometriosis? Do you have cysts? Are you growing hair in abnormal parts of your body? Are you losing the hair on the outer third of your eyes? Are you starting to thin around the hairline? Are you starting to get like puffy eyes, eyes underneath? Like every single thing is a clue about a part of your body that's not functioning, and then the person has to understand how all of your body works together, right? In order to function properly. So I guess what I'm trying to say is that blood work on its own is not useful. You have to have the blood work interpreted in combination with an expert who can like help you kind of navigate the results, and also takes the time to really like, get you to fill in questionnaires and do a nice detailed history and really put all the pieces of the puzzle. Like the blood work is like one piece of the puzzle. And as I mentioned before, the questionnaires that I use, for example, and I'm sure other clinicians and doctors used it too, is like so good at picking up like problems in the body that I can pretty much predict when people have certain imbalances. And I to the point where I've stopped getting blood work done for my clients, because it was like a lot of money that they were spending, and we ended up doing the same stuff anyways. Regardless of the tests, we still had to work on the diet. We still had to control the blood sugars. We still had to figure out their food sensitivities and do an elimination diet together. We still had to detoxify the system and support it, natural detoxification support of the systems. We still had to work on the digestion and heal the gut. We still had to work on stress. Like, we still had to do all of those things, because even one abnormal test, you have to do all those things. So whether that abnormality shows up in your estrogen or your progesterone, your cortisol, or your thyroid, or your, your sensitivity, your inflammation markers, you still need to do all of those things. It's not like, oh, progesterone is low, let's do this one thing of this protocol. Oh, thyroid is low, let's do this one thing of the protocol. No, you still need to do the whole protocol. Okay, so if you still need to do the whole protocol because your body is telling you that it's not happy, then what's the added value of that test, right? We're talking about being in the health promotion phase. Now, if you're someone who has like breast cancer or family history of breast cancer, and we're working really, 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 really hard to get your risk of breast cancer down, then we would consider doing like a Dutch hormone test, where that test is one where it actually takes your estrogen and tells you which of the kinds of estrogen is in your body. And there's the good kinds and the bad kinds. And then if you see that the bad level is still up, then we got to go harder, 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 drill down even more, even more. So that is the one time that I would use something like the Dutch hormone test, and I would be interested in like all the other things, but I'd still be doing the full protocol. However, if that toxic estrogen level is high, then I would be like, listen, you're working hard. I know you're working hard, and we got to get this down. So we got to work harder. Okay, so that's the one time. That's the point that I'm at right now. Now, the wise woman always knows that the only thing constant in life is change. Is my opinion on this going to stay the same forever? Probably not. Why? Because new tests come out all the time, right? new experiences, new information, new research. So what I am telling you right now is a culmination of all of that expertise that I told about you at the beginning. And if you missed the beginning, I highly recommend rewatching the replay. Plus my own experience, plus my experience with my clients, right? It's an accumulation, and that accumulation continues. I am not frozen in time, so my opinion doesn't freeze in time. All right. And this is currently the way that I operate with most of my clients is I tell them, listen, if you want to do the tests, we will get the tests done for you. And we're still going to have to do this protocol, right? Like regardless. So you can do the tests, we do the protocol, and at the end you can retest if you want, or we can do the protocol. You're going to do the questionnaires regardless. So questionnaires when we start, questionnaires when we end. And by the way, like every single woman I work with has like reduced their body like symptom burden like by at least 50%. It's beautiful to watch. And that's what matters to me. Great, the hormones look great on blood testing, but I've seen people have great looking hormones on blood testing and they feel like crap, right? So like what matters to me is whether your body is demonstrating like vibrant health. Is it in vibrant health, right? Which is more than just hormone testing. There's like, first of all, there's hormones we don't even know about. Like they just discovered this new hormone that comes from the muscles. You know, I'm just looking into that now. Like I didn't even know that. And there's like incredible things about the body we don't know about. So it's just like a really tiny picture, but the body language is comprehensive. How your health is right now, how you're feeling, how you're looking, how you're, you know, how everything is running, the system is operating, that's a comprehensive look of your health, right? And when you have like the right kind of questionnaires and the right kind of expert asking you the right kind of questions, you really start to drill down on what it is that's going on and the root causes. Because again, the hormones is like the picture of the traffic accident. Remember I told you at the very beginning? If you have a traffic accident happening and you took a video of it and you only took a shot of it, like you can see like the two cars are touching each other, right? But you don't know like who caused the accident. Was car A driving too fast, car B slamming on the brakes? You can't tell from that picture. Same thing with the hormones. The hormones do not give you a root cause for why the hormones are imbalanced. The root cause comes from the interview, comes from the asking of the questions, comes from filling out the questionnaires and being a very comprehensive look at like your life and your story and what's happened over time. How is your body now? What's your body language now, right? And the other thing is, I just want to mention this before I finish. And ladies, if you have any questions, anyone who's joined me, please pop your questions in now so I have enough time to answer them. Is that I did the hair tissue mineral analysis testing and some testing for heavy metals. I was like, okay, do I have heavy metals that I need to detoxify? Well, I had heavy metals. I had aluminum, I had mercury, like all these things in my hair, right? And then I was like, okay, well, I wonder if like my children have heavy metals. And then my children had heavy metals. They had lead, they had aluminum, they had mercury. And then my husband and my in-laws and my, you know what I mean? Like every single person I tested had heavy metals. So you know how I operate? I operate on the assumption that we all have heavy metals in our body. We're one with the environment. The environment is polluted, and so we have pollution within ourselves. So with every single person I work with, I work on getting those heavy metals out using very natural, targeted supplements that have been proven in research. Beautiful research showing that they help gently eliminate these heavy metals over time. Okay, so yeah, you can pay, and I have access. I can get you a heavy hair tissue mineral analysis for $150 US, no problem. I'm happy to do that. Will it change what we do together? Probably not, right? Because some heavy metals like lead are stored in the bone and they only get released as you age. So sometimes women go into menopause and they start to lose bone mass, and then the lead that's been inside of the bone starts to be released into the bloodstream and they start to feel really, really crappy. So what do I do with women who are in menopause feeling crappy? I work on their hormones. I work on their detoxification, right? I do all of the root cause things because essentially most of us have had some kind of exposure to something in the past, right? And fortunately, there are very lovely protocols that you can put into action that address all of those things very naturally, very safely, okay? And so you can spend the money on the testing, or you can save your money and put it towards your protocol. Or if you have abundant money, you can do the testing and the protocol. But the one time I do reliably do the testing is if we reach a point where I feel like we've done all of the protocol, we've really worked on the lifestyle, everything is as good as it can get, and you're still not feeling well, then we do the testing, right? To see, like, is it like a persistent parasite, right? Like, and I do help, for example, with parasites, you know, that kind of stuff. But let's say we did the regular protocol and it's just not enough, and then we have to go in and see, is this particular parasite something where we do actually have to like use a medication, something like that. Okay, so I know it's a lot of information in a short amount of time. But I just wanted to address, like, there's some people who are like, well, I want to, you know, like, I really, really want to do the testing. And I want you to understand that what's going on in my mind about the testing is that we certainly can do the testing. However, it is very unlikely to change the protocol that I will use, simply because for me, your body language trumps it. Like, if your testing shows that your thyroid levels are like within normal, like within common range, right? Not normal, common range. But you're telling me, like, your body's telling me that the thyroid is not working because all of the signs and symptoms of low thyroid are there when we do the questionnaires and do the history and everything. Well, I'm going to help you with your thyroid. I'm not going to say, well, your thyroid tests are normal, so there's nothing to be done. Your body is like wins every time when it comes to figuring out if something is up or not. Okay, so I hope you found this helpful. I do have a video called Body Language, like understanding your unique body language, which I think ties in really well to this as well. Please, if you have any questions, put them in the comments, and then I can, you know, in the next live, I can answer them. If questions, we can do a part 2 on this if we need to. Happy to hear from you. And I hope you found this useful, and I hope you have a really wonderful rest of your day, evening, or night, depending on when you catch this replay. Okay, bye.